There aren't many areas in healthcare as technology-driven as radiation oncology. With the ability to target cancer tumors with pinpoint accuracy while reducing patient side effects, the Versa HD at the Sheila K. Riggs Department of Radiation Oncology is top of its class. I met up with senior radiation therapist Tracy Cope to get an up-close look at this groundbreaking machine. Looking at what I'll call the nozzle, it's big, and the hole underneath it is big as well. So are we talking about a big beam of radiation coming down, and is it dangerous?
Potentially you can have large fields, or we can do like 1/2 centimeter by 1/2 centimeter. We have little lead fingers called multi-leaf collimators that are in this machine that move. We can get exactly where the doctor wants them treated and spare surrounding tissue. So it is very exact, whereas a long time ago, and I'm not going to tell you how long I've been doing this,
Okay.
but we used to treat with larger fields with lead focus blocks. So now most of the shielding is up in the machines. We can maximize the dose to the tumor area and minimize the dose to surrounding treatment.
When you say dose,
area.
you're actually sending the radiation down to the inside the patient and destroying something?
We're destroying the bad cells. We're also destroying the good cells, but by spacing the treatment out over days and weeks, those good cells regrow.
The bad ones do
The
not?
bad ones do not.
That's amazing, I'll tell you that. And when you're targeting somebody, if they're laying on the table, how do you keep them focused?
To get them to hold still, if we can use immobilization devices, we will, with either what's called a vac lock, which is like a bean bag, and we form it to whatever area, being arms, legs, and then we suck the air out of them and they become hard, and that's used every day for their immobilization device. Or we can make masks. That way we can put the marks on the patient's mask and not on the patient.
And if somebody had this on, you would shoot through it or?
Through it.
Okay. And that plastic doesn't get in the way, obviously?
No. The table, also we treat through the table. It's a carbon table, so it does not change the radiation beam.
Thanks to the Versa HD, radiation oncology teams can decrease treatment time by delivering more power more accurately. On average, how long would a patient be on the table?
Maybe 10 to 15 minutes. If they don't get a positioning scan, 5 to 10 minutes.
Okay, so they're not there for a long time?
No. And the radiation is not on the whole time.
Okay, and you mentioned this is different than what you used to do. How so?
We used to treat with straight, usually either front and back treatment, or 4-field, front, back, and both sides, with the lead blocks that I told you about. We would maybe treat those people with 25 treatments. The side effects would be more severe. This machine can do 6 degrees of motion to get them even more exact on their marks, but we can also tilt the table 3 different ways.
Wow,
so instead of having to come in and reposition the patient, the table's basically doing the work, which saves a lot of time for the patients to be on the table.
Fascinating stuff. Of course, technology is only as good as those operating it. And luckily for the patients here, GBMC has some of the most experienced and dedicated in the business.
I've been doing this for 31 years, and where it started to now is amazing. And just to learn new things, I love it.
It's always my mantra, to learn something new every day and then to use what I learned today sometime in the future. So, and I'm sure you do that.
That's a good mantra.
I'm sure you do that every day. Truly an amazing machine and part of radiation oncology here at GBMC. For Greater Living, I'm Don Scott.